Hi, I'm Dr. Cynthia Clark, acupuncture physician, applied clinical nutritionist, creator of Energy Evolution, president of Longevity Wellness, and triathlete. And I want to talk to you today about exercising in the time of COVID. I'm currently training for Ironman Florida, so I've been spending a lot of time exercising outside, and I have seen a number of people wearing masks as if they exercised. I was very curious about this, and I decided to do some more research on it to find out what was really healthiest and safest. And I'm here today to share that with you. Things that either I was curious about or I heard other people express curiosity about were: one, exercise, whether it increased or decreased the risk of COVID. I noticed a number of people were afraid of exercising. They were afraid to go to the gym in particular. Two, face masks increasing or decreasing physiological performance. Does one get stronger when one wears a face mask? And three, does a face mask increase or decrease the risk of getting COVID? Common sense tells us that exercise is important, but what does it really do? And why is it so important during stressful times? Why is exercise such a great stress reliever? And why does every single modality, whether it's allopathic Western medicine, Chinese medicine, Eastern medicine, any kind of modality indicates that exercise is the number one thing that's most important to do for health over the lifespan or longevity. So first of all, it increases oxygen to the cells, and that means that more carbon dioxide comes out more quickly. By the way, this can also feel like runner's high. This is one of the things that's tied to runner's high and the neuroendocrine loop that goes along with that. And it increases cellular metabolism, so your cells turn over more quickly, just like a child's does. So this is why it's one of the anti-aging methodologies. It improves mitochondrial ATP production, so you get more energy. It reduces both chronic disease symptoms and your risk for getting a chronic disease, and it increases vitality. I was just talking to a lady the other day who had multiple sclerosis, and she was an athlete before she got this diagnosis. As soon as she got the diagnosis, she went and she read a bunch of biographies about people that had multiple sclerosis and had overcome it. And what she found was that every single one of them had the same punchline of clean up your diet and exercise and you'll feel better. And since she was already exercising, she's an endurance cardio athlete, when she cleaned up her diet, she immediately started feeling better. She decided she would just cut to the chase and do the most important thing. Exercise increases the mitochondrial ATP production, and that is basically what energy feels like to us. So the more you exercise, the more energy you get. That's why you're smarter, that's why you're faster, that's why you move better and you think better. It improves blood oxygenation. We're going to talk more about that in just a moment because that one's really important right now. It decreases that mental processing time, so you get smarter. It improves your skin tone. It improves your collagen production and the moisturization in your skin, so you get prettier. And it stabilizes moods. In Western medicine or in functional medicine, we talk about that by increasing serotonin production. In Chinese medicine, we talk about it as liver qi stagnation. So when the liver becomes toxic and gets gunked up, then those pathogens get blocked up in there, and that feels to us like irritability, crankiness, quick temper, or depression, sludge, constipation. So when things start to move, if you've ever started running and then gone, oh God, I've got to poop, you've experienced things moving, specifically bile and the cholinergic response of the liver pushing bile through. What you're experiencing is you're experiencing the 30,000 different independent actions of the liver coming more to life and acting more fully. With more blood flowing through the liver, then we have a higher ability of the liver to flush toxins through or to soothe liver qi, as we say in Chinese medicine, because the liver is responsible for part of our endocrine production and our hormone creation, which is the precursor for our neurotransmitters. That's how we get to increase serotonin production. Here's one of the things I was really curious about, because I know that in clinic, one of the diagnostic techniques for evaluating whether or not a person is likely to have COVID is their pulse oxygenation level. That's the little gadget you stick on the finger and you check for blood oxygenation level. And what we find is that if somebody has a pulse ox of 94 or less, then they're potentially a candidate. Okay, so if we're checking blood oxygen as a likely candidate for COVID, then how much sense does it really make to be exercising with a face mask? But that was one paradigm. The other paradigm was, I used to live in Colorado Springs, which is home of the Olympic Training Center. And the reason that it's home of the Olympic Training Center is because it's at altitude. And that means that people are walking around in a state of oxygen deprivation. So how dangerous was it really? The next thing I want to share with you is that clinically, one of the things that we do is that we treat blood oxygen. So I've really enjoyed treating the symptoms associated with COVID because I've gotten to bust out my favorite at altitude supplements. I really like to go from sea level to 14,000 feet and hike a mountain. And so I know all the best tips and tricks to do that. And those are all applicable in the treatment of COVID and post-COVID. So here's what exercising with a mask does. First of all, it decreases our oxygen intake. But more than that, we respire carbon dioxide, but when we're wearing a mask, we breathe that back in. And the efficiency of muscle metabolism depends on the patency of the oropharynx, the autonomic stability, the cardiac fitness, and the muscle supply. The reason that that's all important is because when we get to this peripheral vasodilation situation, what we're finding is that this increase in lactic acid and this decrease in being able to get rid of the toxins of the carbon dioxide winds up with things like headaches. But it's not that simple. It has a lot more effects too. For example, it decreases the immune cell's motility. So that means your immune system is actually getting weaker. It decreases muscle metabolism. So it actually means that you can lose muscle mass because you're not getting enough oxygen to feed your muscles. It increases the glomerular filtration rate, which is one of the kidney markers. It's just how well blood is moving through the glomerulus of the kidneys. And what we find is that you can actually damage your kidneys over time by that increase in carbon dioxide that's constantly recirculating, because it's not just not enough in and not enough out, but then we're getting into the state of hypoxia. We're breathing that carbon dioxide back in. That leads to a decrease in cognition. So, I mean, it makes sense. If you were sitting at the back of the tailpipe of your car and breathing in that carbon dioxide, you wouldn't be doing very well. This is a much lesser version of that, but in a way, that's a little bit of what you're doing. It also makes it harder on your heart and on your lungs, and it increases your anaerobic metabolism. So what we're looking at here is we're looking at normal exercise and what usually happens, and then we're looking at what happens when we're exercising with the masks. So you can see here's where our poor immune system, our increased cardiorespiratory stress comes into play, our altered renal function, and our reduced brain metabolism and mental health comes into play. Face masks induce an acidic environment both at the alveolar and the blood vessels, and this includes numerous physiological alterations when exercising with face masks. So we're talking about that metabolic shift because of the acidic state that you're in, the cardiorespiratory stress, the excretory system altercation. So there's only a few ways that we get rid of toxins. We breathe them out, we pee them out, we poop them out, and we sweat them out. And when the breathing bit isn't working as well, then we're not getting rid of toxins as much. And by the way, that can affect the other systems. So you may experience things like constipation from the lack of proper oxygen flow in your body. It's a decreased immune system, and it's a decreased brain and nervous system. So finally, this is from a Pubmed article that was published online in June of 2020. It will be published in November 2020 in the Medical Hypotheses Journal. And I want to read this specifically to you. Can face masks increase the risks of coronavirus? So basically, is wearing a face mask setting you up to be more likely to get sick? The answer is this quote. I hold a lot of stock in this quote. Though the respirator masks are perceived to be the barriers for preventing aerosol depositions to the respiratory tract, the bitter reality is that masks actually increase the risk of more in-depth respiratory tract infections. So yes, not only can it increase the risk of COVID, but it can increase the severity of it. And that's really where things get dangerous. So whether it's you or a loved one, please take this information into careful consideration when considering exercising with a face mask. Much better to just be socially distanced, make sure that you're not breathing the air of the person right next to you, sucking their wind, and simply keep your distance and keep your face masks clear so that you don't end up increasing your risk of that acidic state and decreasing your immune system. If you would like more information on amping the awesome of your immune system, of your cardiorespiratory system, of your athletic ability, and of your life in general, then please contact us. Happy to help. I'm Dr. Cynthia Clark with Longevity Wellness, and you can reach us by this contact information here. Enjoy being outside, enjoy the sunshine, enjoy your exercise, enjoy all of the goodness that life has to offer, because there's a lot of it going on right there, and there is nothing that amps my awesome better than a nice, good, long bike ride. So please enjoy.